Welcome to my Turkey. So you made it. You got your implant placed, you went through the surgery, and now you might be thinking, I'm done. My job here is finished. Not quite. The truth is, you have only just begun. This is the healing phase, and how you behave during this phase will decide whether your implants succeed or fail. You are now in a very delicate period. Your implants are inside your bone, but they haven't fused yet. This process is called osseointegration, and it takes time. Usually, if you had a standard procedure, it takes around 3 to 4 months. If you had a sinus lift, especially an open one, it can take up to 6 months. Let me explain to you why it takes long. Because we are not just waiting, we are building a solid biological foundation. If the pressure is applied too early, it doesn't matter how perfect the surgery was, the implant may fail. And that's the part of no one talks about it. But I will. Let's talk about those temporary teeth. Some of you left the clinic with removable dentures, some with fixed bridge, some with nothing. So let me be honest with you. Temporary teeth are not real teeth. They are not designed to last. They are not meant to chew. They are for aesthetical only. If you have removable dentures or temporaries, they are unstable, weak, and very likely to move or break or fall out. Why? Because your gums haven't healed yet. There is no stable surface. It's like planting in a flag in sand. Honestly, the healthiest option would be to go without any teeth during the healing. But most patients can't accept that. So we give you something visual but fragile. If it breaks, if it falls out, that's not a complication, that's expected. Please don't panic and don't use them like they are permanent. One of the top causes of implant failure during healing is this: unintentional pressure. Maybe it's eating on the wrong side, maybe it's biting a little too hard, maybe it's grinding at night. You might not even feel it, but your implant does. Here is a rule. Don't chew anything tougher than an omelette for the first few weeks. Avoid sticky, crunchy, or chewy foods completely. If something feels like it clicks or causes discomfort, stop. Your implant is silently fusing. Let it do its job. Now let's talk about some early healing signs. Swelling, normal. Light bleeding on day 1-2, normal. Minor bruising on the cheek, normal. But continuous heavy bleeding, a bad smell or pus from the stitchers, unusual pain after day 5, these are not normal. If that happens, contact your aftercare support immediately. And those stitches, if they fall out after a few days, don't worry. Some are self-dissolving. If they feel light or start cutting into your tissue, let us know. Don't fix it yourself. Now, I'm gonna say something you don't wanna hear, I know. Smoking is the #1 enemy of implant success. It reduces blood flow. It slows healing. It increases infection risk. And worst of all, it increases the chance your implant will fail. So please, cut it down if you can, quick. You invested in a premium treatment, don't burn it away. Sometimes you do everything right. You brush, you follow all the rules, you eat soft food, you don't smoke. And still something goes wrong? Because here is the truth. Your body has the final say. Some people have slow bone metabolism, some have uncontrolled diabetes, some have genetic conditions, but that affect healing. We don't always know until we start. So if problem happens, don't assume it was a mistake. Sometimes biology just plays a different game. Yes, it can happen. And if it does, it usually means the implant didn't fuse to the bone. This is called a non-integration. In that case, we remove the implant, we clean the area, we let it heal. And after a few months, we try again, if the bone allows. You won't be left behind, but we need your patience, your trust, and your full commitment to Aftercare. You are not done, you are healing. You are in the most important phase of the implant journey. What you do now, how you eat, how you clean, how you protect that smile, decides what happens next. All the information I shared today is also written on your post-op information. Read it, keep it, and if you are not sure about something, contact your dental consultant. Call our Aftercare team. And remember, this is your smile, but it's also our responsibility. I am Zeus, and I will see you again when it's time to finish what we started. Stronger than ever. Take care of yourself. See you later.